Hello everyone, my name is Anita. I am a registered nurse. Today I am going to discuss few questions, its answer, and I have tried to explain the options along with rationals so that it becomes easier for you all to understand. So there are 5 questions along with its answer and rationals from obstetrics and gynecology. These questions are similar to NCLEX examination. So if you are preparing for your NCLEX examination, this video is gonna be really very helpful for you all. Situation 1. A 39 weeks neonate is being assessed by the nurse 1 hour after normal vaginal delivery. What are the expected findings? So this is SATA question, that is select all that apply. So you have multiple options to choose from where more than one answer can be correct. So the options are: option 1, when the lateral sole surface is stroked, toes fanned out. Option 2, one artery and one vein in the umbilical cord. Option 3, white pearl-like cyst on gum margins. Option 4, plantar creases up to the entire sole. So in between you can pause and guess the answer. So there are more than one answer that can be correct. So the correct options are option 1, option 3 and option 4. Now I will try to explain why these options are correct and the answer that is excluded, why that particular option is not correct. So in option 1, it's Babinski reflex. This means this reflex is present in a neonate and can be present up to 1 year. So here the toes are hyperextended and fanned out when the lateral surface of sole is stroked in upward motion. So this presence of this reflex suggest for normal physiological or normal neurological development in the baby. However, if this reflex is absent, then it indicates certain neurological effects. So one need to be very careful while assessing neonate immediately after the birth. So option 2 is incorrect because umbilical cord consists of 2 arteries and 1 vein. So presence of only one artery and only one vein is associated with certain abnormalities that might indicate heart or kidney malformation. So this option is excluded here. In option 3, it talks about Epstein Paul. So this is normal finding because this may be present in neonate. So it's a cyst or like epithelial tissue, a cyst that is present in gum margin or it may be in the palate. So it disappears within a week. So this is the normal finding. So this is also the correct option for this question. Option 4, it talks about plantar creases. So it is also the normal finding, and the number of plantar creases suggests the age of the neonate. So it is present in the bottom of the toe. So presence of this is normal finding. So this is also the correct option for this situation. So here correct options are 1, 3 and 4, and number 2 is the incorrect information. So this should be excluded here. Now let's go for second situation. Situation 2. Here, what things should nurse keep in mind while preparing to administer oxytocin to induce labor in a client? So options are option 1, it indicates it decreases postpartum hemorrhage. Option 2, it delays milk production. Option 3, it poses risks for placenta previa. Option 4, it leads to unnecessary cesarean birth. So you might pause the video and guess for the answer. However, I will be explaining correct option along with its rationale later. So here option 4 is the correct answer. It leads to unnecessary cesarean birth. So why this option is correct? Now I'll be explaining it along with other options. So oxytocin is the drug that is used to induce labor because it stimulates uterine and it increases the uterine contraction and it helps in labor. So it is used to induce the labor. However, increase in contraction leads to decreased placental flow to the placental blood flow, and if there is decrease in placental blood flow, there might be decreased oxygen supply to the fetus during the labor. So if there is decreased oxygen supply for prolonged period of time because of the use of oxytocin for inducing labor, which increases the contraction of uterus. So because of all this process, there is decreased placental blood flow leading to decreased oxygen supply to the fetus, which mm, leads to different condition in the fetus, especially related to fetal heart sound. So there might be non-assuring fetal heart patterns, like there might be like delayed or late deceleration. There might be fetal bradycardia or even tachycardia. So because of all this reason, it might lead to emergency CS. So oxytocin plays role in increasing the cases of emergency cesarean section. So because of this reason, option D is the correct answer. So why the option 1 is incorrect? So what's there in option 1? So in option 1, it decreases postpartum hemorrhage. So use of oxytocin doesn't play a role in decreasing postpartum hemorrhage. However, in postpartum period, nurse should assess for any bleeding, excessive bleeding that might indicate PPH. So nurse should assess this one. So for this, nurse should assess the uterus, if it is boggy or if it's not contracting. And here in this case, because of the use of oxytocin, the uterine muscle gets fatigued, so there is decreased contraction after the delivery. So because of decreased contraction, there is no pressure in the blood vessel, resulting in increased blood flow, leading to the risk of PPS. So this option is excluded here. Option 2 is incorrect because so what's there in option 2? It delays milk production. There is uh, no relationship between oxytocin and milk production. Oxytocin actually helps in let down reflex, that is release of milk, but the hormone prolactin is responsible for milk production. So this option is excluded here. In option 3, there is no relationship between oxytocin, use of drug oxytocin for inducing labor, and the cause of placenta previa, because placenta previa is abnormal implantation of placenta, which is physiological, and these two situations is completely unrelated to each other. So this option is also excluded here. I hope this is clear for you all. Actually, you all need to be very thorough, or you all need to go through the rationale properly, because it will help you while answering other questions later on. Now, situation 3. A woman who has CS 5 hours ago is anxious and complains of shortness of breath. The nurse should assess for which priority problem before contacting doctor. So this is the priority questions. The options that are given might include more than one correct option, but you need to choose one which is at its highest priority. So here the options are: option 1, increase in body temperature; option 2, cough, warmth and redness; option 3, elevated WBC; option 4, incisional discomfort. So you can pause and guess the answer. So the correct answer is option 2, cough, warmth and redness. So why this answer is correct? Because redness, tenderness and warmth in the calf might be indicative of deep vein thrombosis. Actually, pregnancy is the hypercoagulable state. So, because of this reason, after the delivery, there is high risk of developing deep vein thrombosis. And this deep vein thrombosis is responsible for causing pulmonary embolism. So, if there is pulmonary embolism, then there will be shortness of breath and the patient might feel anxious. So, feeling anxious and shortness of breath are the symptoms of pulmonary embolism, which is indirectly or directly caused by deep vein thrombosis. And deep vein thrombosis is the outcome of a hypercoagulable state that one goes through during pregnancy. So, one should assess for calf warmth and redness, and one should inform these symptoms to the doctor. So option 2 is the correct answer. Option 1 talks about increase in body temperature. Actually, increase in body temperature within 24-hour postpartum is normal, but just it should be below 100.4 degree Fahrenheit. So it's normal for first 24 hour. And option 3 talks about elevated in WBC. So WBC elevation in WBC is also expected findings within first 24 hour. So this is also the normal finding. Option 4 talks about in-seasonal discomfort. So while having CS, there is in-season, and it's normal to feel discomfort postpartum because one might feel pain or there might be some discomfort because of a decrease in mobility or because of pain. So because of all this factor, feeling discomfort is expected finding. So this option is excluded here. I hope this explanation is clear for you all. Now let's move on to next situation. Situation 4. A nurse is assessing newborn and finds hand and feet to be bluish. The trunk is pink. What is her initial action? This is also the priority questions. I have talked few things about priority questions before also. So let's see the options. Option 1, observe for respiratory grunting. Option 2, apply oxygen and continue count respiration. Option 3, assess heart sound. Option 4, place neonate to skin contact with the mother. We can pause and guess the answer. The correct answer is option 4. Now let's talk why 1, 2, 3 options are incorrect and why option 4 is correct along with its rationale. So option 1 talks about observe for respiratory grunting. So there is no relationship between decrease in body temperature of neonate and um, respiratory grunting. Respiratory grunting and murmur might indicate other physiological problems. So there is a term called acrocyanosis. Acrocyanosis is peripheral cyanosis that includes the cyanosis of hands and feet. However, trunk is pinkish in color. So this is normal finding within first day or within 24 hours or up to 7 to 10 days after the birth in unit. So there might be several factors that might be playing a role in order to decrease the body temperature of the baby. So this might be because of cold. So keeping baby skin to skin contact with mother is the best option. So kangaroo care should given more priority. So this should be the initial nursing management for the baby who has acrocyanosis. However, while keeping skin to skin contact with the mother, nurse must pay attention and regularly check for the temperature and respiration of the baby. Nurse should make sure that baby is breathing well and her nose and mouth is not in direct contact or there is no any obstruction in airways of the baby. So nurse should keep all this thing in her mind. So option 1 and 4 talks about respiratory grunting and murmurs. So this is all related to acrocyanosis. This might indicate other physiological problem like cardiac or respiratory abnormalities. So this option is excluded here. And transient acrocyanosis without central sinuses is not the thing, not the alarming thing. However, if there is sinuses in all over the body, including trunk, nurse should take immediate action. This is red flag for the baby. So option 2 talks about a need for oxygen because acrocyanosis is not serious condition. This is normal finding. This might be due to several factors like as I mentioned earlier because of cold. So taking simple actions like keeping skin to skin contact with mother or keeping baby under the radiant warmer might um, improve the circulation of the baby or improve the temperature of the baby, and this problem might solve. So there is no need of supplying oxygen to the baby because there is no need of oxygen. Now let's see next situation. Situation 5. The nurse is checking chart of postpartum client. Which of the following she considers as the risk factor of early postpartum hemorrhage? This is SATA questions. Select all that apply. So there are options which are correct, like which more than one options that are correct. So option 1, grand multipara. Option 2, prolonged third stage of labor. Option 3, infant birth weight of 9.2 lv. Option 4, drop-free delivery and labor. Option 5, labor lasting 12 hours. You can guess the answers. So the correct answers are option 1, option 2, option 3, and 4 and 5 options are excluded here. So why these three factors or these three options are correct, I'll be talking and explaining why other two options are incorrect. So like postpartum hemorrhage within 24 hours is known as early postpartum hemorrhage. So there are several factors that might play role in a role to lead this situation. For instance, uterine atony causes 80% of the postpartum hemorrhage. So you should assess the patient for any soft, boggy, and poorly contracted uterine by assessing the patient. So contributing factor for uterine atony are uterine overdistension. So if there is overdistension because of multiple distension, polyhydramnios, it might cause uterine atony, and there might be uterine fatigue because of prolonged labor or because of extreme contraction because of the use of labor-inducing drugs like oxytocin, grand multipara, and uterine relaxants and anesthesia. These all factors contributes for uterine atony, and if there is no contraction in the uterus after the delivery of the baby, then there is no compression in the blood vessel, and because of this reason it leads to hemorrhage. Drug-free labor reduces the chances of PPS because there are several drugs, like as I mentioned earlier, oxytocin. Because of use of oxytocin to induce the labor, it might cause hypercontraction of the uterus, leading to fatigue of the muscles. So in postpartum, this leads to PPS. So if there is no use of any such drugs, then there is no chance of PPS. However, you need to assess the patient even if there is no any such indications, or even if there is no any such situation, even though nurse needs to observe for PPS after the delivery of the baby. So option 5 talks about 12 hours 12 hours long delivery. So this is a normal time frame for delivery. So this does not play any role in post PPH or causing hemorrhage postpartum. However, if third stage of labor is prolonged, if it's more than 30 minutes, actually usually less than 30 minutes is considered normal time frame for third stage of labor, which is the time between delivery of the baby and expulsion of placenta. But if this period is prolonged, then there is chance of placental fragments or placenta to remain inside the uterus. So this might lead to hemorrhage after the labor. So one need to assess for time period or time frame for each stage of labor and even other contributing factors, and should assess patient accordingly after the delivery of the baby. I hope you all are clear with all the explanations, questions, and rationales. What I suggest you all is you should go thoroughly with all the rationales, because it will be really helpful for you all later on. These are all the situations that I talked today. I will be happy to discuss about other questions in my next video. Thank you.